when I started, my goal was to demonstrate that in fact the subjects were not lying, because when we did the conventional imaging exams, they always came out normal. So in almost practically 100% of cases, the MRIs or CT scans were normal, and yet the patients were complaining of symptoms. And so, in the case of litigation, an insurance company would say, well, you know, the scans are normal. It's probably something psychological that you have. There's nothing wrong with your brain. And so my goal was to demonstrate that in fact there was an underlying pathology to the symptoms. And this is when I started using functional MRI, that is looking at the brain in activity. So we put the subject in the scanner and we have them carry out a task. And while the person is doing the task, the regions involved in carrying out the task will demand more blood and more oxygen. And that's how we can see a change. So it will be a functional change that we saw. And what we saw is that those regions that were affected would show less activation proportional to the severity of the symptoms. So the greater the symptoms, the less the activation in those regions of the brain. And this is essentially what you're seeing here. You see the control subjects are showing these activations here. And then as the symptoms increase, you see here where the high symptoms, you see that the activations are almost absent here.